Hi everybody, I'm Dr. Ed Casper, lead doctor here at RxWellness Tysons. Lower back pain is a very common issue that we see, especially nowadays and especially in this area. You know, the DMV, very corporate, a lot of people have desk jobs. Typically that pain's coming from degeneration and osteoarthritis in their lower back. A lot of times these discs get really thin, there's less cushion in the spine, which can cause and produce a lot of lower back pain. So really the best time to come to a chiropractor is before you're even having symptoms. Really what we're trying to do is preserve the discs that you already have and the spine that you already have so it doesn't get worse over time. Once you start producing symptoms, it's almost like a smoke detector, you know, sounding off. And that's what's letting you know that you're having a structural issue. So desk jobs are really detrimental to your spine because they can really cause a lot of degeneration in the lower back, especially when we start to lose our posture. If we start to hunch over, which a lot of people do, their spines get tired, they're sitting at the desk all day. You can imagine what this is doing to your spine compared to the more upright posture. With your shoulders back, your spine in an upright position, it really causes a lot of degeneration in the lower back and then producing, you know, pain and discomfort. So yes, sitting is that bad, and they call it the new smoking, and here's why. Because a lot of times when you're hunched over, you're not allowing your thoracic cage to expand the way it should, so you're really hindering your lungs' abilities in doing that. And you can imagine over years and years what it's doing to your lungs. So in that way, sitting is the new smoking because it's hindering your lungs' maximum capacity. So the reason why good posture hurts is because it feels abnormal to you. And the reason it feels abnormal is because you haven't been doing it correctly in the past. So our job as chiropractors is to encourage a more proper position and posture. And then it's your job at home to help build the muscles to help support a more proper posture. So from the side, a good posture looks something like this. We want your ear to be over your shoulder and your shoulder to be over your hips. So even when you're sitting, we should have that straight vertical line down the side if we're looking at you from the profile. So the first move you should do when you first get to your desk in the morning is start with some daily exercises. So when I take a seat at my desk here, the first exercise that I'm going to be doing is spinal rotations. So with a good posture, like we just talked about, you're going to do some spinal rotations back and forth, 10 times in each direction. Then the next one is spinal lateral bends or flexions. You're going to take your arms like this and you're going to bring your ear to your shoulder and your shoulder to your hips, 10 times in each direction. And then the last one are flexion-extension. So you're going to have your palms on your thighs and you're going to inhale while extending. And then you're going to exhale and go into flexion. So you'll do that 10 times as well. And you could start with that each day in the morning. So a lot of times people have weak rhomboid muscles in the back and they have overactive or tight pectoral muscles. So a lot of times that's what allows our shoulders to roll forward. Whereas we want to engage these muscles back here to keep our shoulders retracted. So at the gym, doing things like row exercises, that's going to work your rhomboids. Whereas, you know, more like a bench press would work these, but it's good to stretch out your pectorals and we want to strengthen those rhomboids to bring your shoulders back over your retracted. A couple other stretches that you can do for the lower back are the child's pose where you're on all fours and then you bring your butt back to your ankles just like that. Hold it for a couple seconds, then you come back, try to get a little further each time. And then to isolate a certain side, so if your left side's hurting, you know, you'll bring both hands to the right and you'll bring your buttocks back to your left ankle. So you'll go back like this. And then vice versa, if you're having issues on the right side, you bring both hands to the left and bring your butt back to the right. And that's child's pose. The next one that you can do is what we call the cobra, or people call it Mackenzie stretches, where again, you're on your stomach and you're gonna keep your pelvis on the ground, but you're gonna extend your back as far as you can go while also extending your chin and your head. You can hold that for 10 seconds. This is really good for disc problems. And then you'll go down. I would do sets of 10 of this. Go as far as you can. The best time to do these workouts are first thing in the morning to lubricate your spine, get your joints moving, and then sometime in the afternoon or evening before you go to bed. So stretching is great and it helps with a lot of things, but a lot of times it doesn't address the root cause, which is spinal misalignments. subluxations as we call them. So a good thing would be to accompany the stretching with chiropractic care, and that's where we come in. You know, I'm at the Tysons location, but all of our doctors within RxWellness are really great, and they'd be happy to assist you with your spinal complaints.